Dave. Welcome, welcome. Hi, this is Dr. Sarah Merritt at Lifestream Health, streaming to you live from my office in Bowie, Maryland. I've seen some patients today, but at the end of my day, I wanted to bring everybody something special, which is an interview or some discussion with Dr. Jarita Hagans, who is a primary care doctor with a practice in Washington, D.C. And in fact, here, I'm going to put her information in the chat. For Dr. Hagans. Dr. Hagans, do you mind introducing yourself?
Sure. I'm Dr. Jarita Hagans. I'm owner of Zion Family Practice, and we're located in Washington, D.C. in Southeast. And we do traditional family practice, but I always want to know what the patients are eating and drinking because it affects every medical condition.
Yes. So Dr. Hagans does full comprehensive primary care, but right, diet is a big part of what it sounds like is a passion for you, right? And in terms of caring for patients. I'm curious about your journey. How did you get interested in counseling patients about diet and healthy eating?
So I had a lot of medical issues myself. Back when I first got out of residency, I worked in New Orleans doing a loan repayment program. And the second clinic where I worked was kind of a holistic place. And they had acupuncture and herbalists and nutritionists on staff. And the clinic had its own garden and kitchen.
Oh.
And they would do cooking classes. And I was like, this is how you practice medicine.
That's cool.
Yeah.
That's cool. And I think you've done cooking classes with some of your patients or in your practice. Is that right?
Right. So we do kind of a cooking class or healthy eating class and kind of give people samples and give a little talk about what kind of foods to eat and what kind of stuff to avoid for certain medical conditions, high blood pressure, diabetes, what have you.
That's awesome because, I mean, to a certain degree, I think there are a lot of patients out there that are like, what? Like doctors do that? I mean, I'm a little like, what? Doctors do that? Is that a thing?
Yeah, we do it on like a Saturday, or we might do it on Wednesday after like a Bible study or something like that. Because my office is inside of a church. It's the church that I grew up in.
Oh, that's amazing. I didn't know that about you. I didn't know that was your home church that you grew up in. How
Yep.
cool is that? How
Yeah.
cool is that? Yeah. Well, and you referenced your residency time. I grew up in Alabama, and Alabama, Louisiana, it's full of delicious food, but it's not all healthy. And really everywhere, right? But certainly I can relate to Southern food.
Yep.
That's very cool. That's very cool that it's your home church. So I'm sure you have parishioners that come to see you, but your practice is open to all types of patients. Is that correct?
All right. My practice is open to everyone. Somebody was asking me today, what does family practice mean? It basically means we see your whole family, kids, adults, elderly, everybody.
Everybody. Yes, that's right. Yeah, and it's handy because then you can coordinate care, I suppose, and really it gives you as the doctor like kind of that bigger window maybe into somebody's life, right? You have a little better feel for like who they are because you might know somebody's spouse or somebody's child or somebody's parent, right? In addition to the one patient. I can say that
Right.
certainly in my practice, I've experienced that. And in fact, I had a patient who referred her daughter that I saw this morning. And just a patient with significant headaches that she's been through some workup and just hasn't gotten better enough. But yeah, it gave me a good frame of reference for this, frankly, kind of complex patient that I know her mother and a little more about just their overall picture. That's great. Very good. Well, so
Nice to take care of people that kind of supported you when you were coming up.
yeah, that's cool. Yeah, so that and that's really kind of the model of almost like the country doctor, right? I mean, your Dr. Hagan's environment is very urban actually, right? Because you're in Washington D.C., you're in an urban area, but in a way like it's kind of like small town doctor in the sense that you're super local, your family's been there.
Yeah.
That's really awesome. That's really unique.
Yeah.
Yeah, I think that's really unique, and it is nice to have that that frame of reference with folks. So you had kind of your own journey where you felt like you developed some health challenges, and you felt like diet was playing a role for you.
Yeah, so my main issue back when I was living in New Orleans was acid reflux. Well, one of
Oh,
my main issues. And it wasn't just like spicy gumbo and stuff. It got to a point where like everything I ate and drank caused me heartburn. So
oh,
then I started working at this clinic that kind of had all the herbalists and nutritionists and whatnot. And the
mhm.
herbalists, I actually had a session with them as their patient, and they
Yes.
kind of guided me through doing an elimination diet and repopulating my gut with good bacteria like fermented foods and probiotics. So that's what really got me interested in it because it worked on me.
Yeah. And then does that require some ongoing maintenance? I imagine you develop some healthy habits that you've kept, or are there times you've gone back to do an elimination diet after that, I wonder?
So I kind of know what my triggers are now, and I kind
Mhm.
of know what to do to kind of prep myself for certain foods. Like if
Yeah.
I'm gonna eat pizza for more than 2 days in a row, I kind of have to like prep my stomach with like some Greek yogurt and get those good probiotics in there and kind of coat my stomach before I go eat tomato sauce. Yeah.
Wow. Well, and so that is something, and I guess I don't know if that's anecdotal or if there is, do we have data around that? This is an area I legitimately don't know a ton about, and so I'm interested.
So what I kind of learned from the herbalist was that a lot of the acid reflux was being caused by like an imbalance of gut bacteria.
Hmm.
So I had to kind of reintroduce those fermented foods, and the elimination diet was eliminating stuff that fed the bad bacteria, like processed starches, white bread, white potatoes, white pasta, sugar, stuff like that.
Okay.
Yeah.
And I guess what is a fermented food, and then is there a role for oral probiotics also, like the pill that you can buy at the store?
Yeah, so the fermented foods is like olives, sauerkraut, refrigerated pickles,
Mm,
um Greek yogurt, not really sure how to pronounce it, kefir. I think
uh-huh,
that's how you
uh-huh.
say it, like the fermented kind of milk product or what have you. So
Yes.
those things are fermented foods, kind of like pickled stuff
Yes.
that
Okay.
has good bacteria hanging out in it. Yeah, and there is a role for probiotics, like a capsule that you can buy because there's a lot of people who can't tolerate dairy for whatever reason, so they can't have the Greek yogurt, or they
Mm.
might not be able to tolerate the salt in like pickles and olives. Yeah.
And is one serving of a fermented food enough to make a difference in your gut bacteria? Or if I wanted to help my gut bacteria, if I made an effort to make sure do I need one serving a day or one serving at each meal? What would be enough?
So what they had me do was do an elimination diet for like 2 weeks to kind of starve the bad bacteria. So I was
Mhm,
only eating vegetable starches like sweet potatoes and squash and stuff like that.
mhm.
So no bread or pasta or white rice or anything like that for like 2 weeks. Just kind of meat and vegetables. And then for a week after that, that's when I was doing some probiotic food every day.
Mhm.
And now I kind of have straightened my stomach out. So it's just like every now and
Yeah.
then when I've been bad for a little while, then I might do a couple of days of probiotic food in a row. But now I can probably get away with doing like one yogurt once a week or kombucha once a week or something like that.
Very cool. Very cool. And
Mhm.
does this
Yeah.
I want to shift a little bit to weight loss because I think that's something that you work with patients on. Is there a role for thinking about your gut health if you're working on weight loss with a patient or for yourself or whoever?
Um, in a way, so you have kind of your neurotransmitters or your feel good hormones
Hmm.
that are produced in your stomach, like serotonin, some serotonin, things like that are produced in the stomach. So there is some role to that because it's kind of what's the word I want to use? Kind of like an ancillary thing that can lead to weight gain if
Okay,
your neurotransmitters are not in order.
right.
Yeah.
Okay,
Mhm.
very good. Um, Got it. So it's really the gut bacteria certainly has a role then maybe in gut symptoms and things, maybe less for weight loss, but more in terms of how your GI feels and functions. Very good. Well, tell me a little bit about, I have patients all the time who have questions for me about an inflammatory diet. And hey, doc, would an anti-inflammatory diet be helpful for me? Is that, I think that's something you've worked with patients, and I'd like to hear more about it. And how do you think about a diet that's anti-inflammatory?
Yeah, so in general, the anti-inflammatory diet is something similar to like a Mediterranean diet, where you're having lots of fruits and vegetables and unprocessed grains. So what does that mean? Like oats, or not like the sweetened packets of oats, but like real oats that microwave,
whole grains, yes,
rice, whole grains, beans, stuff like that. But then the other thing that you want to pay attention to is the balance of omega-3 fatty acids and omega-6 fatty acids. So omega-3 fatty acids are coming from things like cold water fish, or deep water fish like salmon, cod, mackerel, things like that. And then also you can get it from plant sources, omega-3. You can get it from walnuts, flaxseed, chia seeds, Brussels sprouts, dark leafy greens. So you want to have more of the omega-3 than you have omega-6. So most of the things that have omega-6 in them are coming from animal products like meat and eggs, vegetable oils like salad dressings and stuff like that. So you want to try to move away from having pre-packaged salad dressing and try to make your own salad dressing with like vinegar and olive oil and some herbs and spices and things. And you want to try to get away from frying food as much and try using an air fryer to get crispiness, or baking it on a higher temperature, things like that. So you want to balance that, because the omega-3 is anti-inflammatory and the omega-6 foods can be inflammatory. Yeah.
And then do you recommend,
definitely want to try to balance those things out?
Yeah. Do you recommend an omega-3 supplement, or how does somebody know if they are in a good enough balance of the 3 and 6?
So you can get an omega-3 supplement, but you definitely want to pay attention to it, because I've seen like some combination pills that have omega-3 and omega-6 mixed together. And if you eat a standard American diet, you probably don't need any omega-6 in your supplement. Yes. Probably want to get a pure omega-3 supplement. Yeah.
Okay.
To make sure that you're getting the anti-inflammatory part of it and not the omega-6. The exception is grass-fed beef. So if you have cows that were fed with grass, then they have the omega-3 in their muscles because they were eating plant products.
Yeah. And yeah, what is that? The omega-3 fatty acid. Let me see if I have this correct. It's a certain type of fatty acid, right? It's the omega is like where the branch of the chain is. Is that right? And then it's just what is the arrangement of it? And the omega-3 is one type of arrangement, and the omega-6 is another. I mean, I think that's more or less it, right?
Yeah. So now you're getting into the organic chemistry, and I'm like, no,
we don't have to touch on that. But I guess I'm just nerdy like that. I'm a little interested of like, what is that anyway?
Okay.
Yeah. So, I mean, I think people are going to be able to see on labels how much of omega-3 is in something, or do they need to just look for those healthier ingredients like olive oil or, special fats?
Yeah, so it's really those natural foods, the things that are found around the perimeter of the store, the produce, the fruits, the vegetables, maybe the nuts aren't on the outside. Maybe the nuts are in the center. Nuts, beans,
mostly not
like
things
that.
in a package. Yeah.
Yeah.
Mostly not things in a
Things that are fresh. Fish.
And then
Yeah, and then if you can't eat fish, then you probably can get a supplement, but you can get omega-3 from plant foods. There's tons of omega-3 in plant foods, even if you
very
can't
good.
do it.
Yeah. Yeah, and so is the anti-inflammatory the type of diet that we just discussed with an emphasis on whole foods, plants, some meats, specific types of meats, cold water fish, grass-fed beef. These are all things that are
Right.
anti-inflammatory diet staples. Is this the type of dietary change that you might recommend? So my patients sometimes are looking for help with pain. And very often, what's been interesting to me in recent years is when people are really at the end of their rope, they're often really ready to make a change and do something different with their diet. Is anti-inflammatory the type of diet you would discuss for someone with pain, or is there something else you would want to recommend as a dietary change to help with pain?
So the anti-inflammatory diet I'm looking at for somebody with osteoarthritis, or the wear and tear type of arthritis that we get from being older and not being 16, or rheumatoid arthritis. That's a really inflammatory condition where your joints are inflamed, and they one of the studies that I saw showed that people's inflammatory markers, or the blood test for rheumatoid arthritis, actually went down with the anti-inflammatory diet.
Wow.
If people were consistent with that. Mm-hmm.
That's pretty awesome. That's pretty awesome. Mm-hmm. And then are there supplements that might be helpful for somebody with pain looking to decrease inflammation? Is there a role for that, or is it more just a dietary recommendation that you would make?
So sometimes I recommend turmeric to people. So there's turmeric, and then there's like a component of it, or the kind of special building block of it is curcumin. So you might see that name instead of turmeric. But what I tell patients is that that kind of takes a long time to work. It's like a slower thing. So you have to be consistent with it and take it every day like a vitamin. It's not going to work today like taking a Tylenol. So you probably are going to have to do over-the-counter or a prescription medicine for pain while you're waiting for the turmeric to build up. And it's not for everybody because it has some blood thinning properties. So if you're on aspirin or other things that's related to aspirin, you might need to be careful with that, because I've seen people have some bruising if they were taking turmeric plus aspirin or turmeric plus ibuprofen or something like that.
And I think I've had patients ask me about, how much turmeric is recommended. Is it 1 or 2 grams? It's a pretty decent amount at times. Is that right?
I can't remember the milligrams off the top of my head. So, and different, depends on what kind of formulation you have. So I usually tell the person to just follow the instructions that are on that particular bottle, because you have all of these, what's the word I want to use? Like all these different formulations where this one is supposed to be more powerful than the other one, and they've extracted the curcumin and whatever.
Very good. Very good. Yeah. So start with the directions on the package of an affordable supplement and go from there. And how long did you say you anticipate a patient might want to supplement curcumin before they would expect to see results? Is it going to be a month? Is it shorter than that? Longer than that?
I would think it would take a month or so to really notice a difference. Yeah. We wouldn't need as much pain medicine.
Very good. Very good.
And then another supplement that I'm big on for muscle pain, well, not necessarily a supplement, but to check on it and see if this is part of it, is vitamin D. People who have like the muscle aches, and it's like, let's find out what your vitamin D level is.
Yes, that is something that we will test and supplement also. And I think there is pretty good data that can be a difference maker. Very good.
Magnesium as well. That's another one to check if there's myofascial or muscle pain.
And do you get a lab for magnesium, or do you just try supplementing it?
I like to see where it is to see if it's actually low. Yeah.
Yes.
So that I don't overdo it.
Very good. Very good. Great. That's great. Well, thank you for all of these excellent pearls. I think we've covered a lot of the things I was hoping that we could cover. Is there anything else that you'd like to leave our viewers with, folks that are looking for improvement in pain or pain and inflammation with diet?
So one thing that I saw that surprised me when I was kind of reviewing the literature for this talk was something about gout. Now we all know some of the things that kind of push gout forward, like meats and shellfish and things like that. But sugar, apparently, sugar and fructose containing drinks seem to cause gout flare-ups. So that was interesting to me. I was like, found another pearl to have my gout patients avoid sugary drinks.
Got it. And so that's interesting, right? Because usually we're the training I'm used to is similar, right? It's that heavy diet, heavy cream, dairy, red wine, red meat, all that stuff, but sugar too.
Yeah.
Very good. Yeah. So if you
now
have
the gout patients are going to be mad, like, I can't have anything.
Right. Yes. I know. Well, but that's an extremely painful condition for sure. My folks that have gout, if it is disabling for sure if you've got a significant gout flare. On the other hand, if you can get it under control, it can kind of just be in the background. You can almost forget you have it, I think.
Yeah.
That's been my experience of taking care of patients. When it's under control, they can be doing really well.
Yeah.
Excellent. Well, tell us more about where people can find you. I've got your website in the comments section, folks. So Zion Family Practice is where you can find Dr. Jarita Hagans. I've had some other guests on this show that are medical colleagues and friends. They are not all local, but if you're local, if you're one of my patients, Dr. Jarita Hagans is local also. She is in Southeast DC and probably 25 minutes from my practice, 30 minutes. I'd have to clock it, but not too far.
Yeah, we are accepting new patients, and people can find a contact form on our website, zionfamilypractice.com, and they can email us, and that email comes to me, and we'll see it, and we'll get in touch with you.
Excellent. Yes. So please, folks that are looking for a primary care, please reach out to Dr. Jarita Hagans. And do you accept a lot of different types of insurance? Can you give us a little preview of that?
Yeah, so we take pretty much everything. DC Medicaid, DC Medicare, CareFirst, Blue Cross Blue Shield, Humana, Cigna, Aetna, you name it. We pretty much take everything. United Healthcare. Yeah.
Excellent. Well, thank you so much for joining us. Thank you for sharing your expertise. I think this is super exciting that you're here locally, that you're in your community, that you're in a church that you grew up in. I just think that's awesome. So I'm just thrilled to have had you here, and we will talk again.
Thank you for having me.
Thank you. Take care.
Thanks.